Dr. Clay Moss, welcome to Podcastina.
Thank you for having me. Appreciate you having me. Galina Rivina's podcastina has a
Yeah,
nice ring to it.
thank you. Happy to have you. Would you mind sharing for the listeners what it is you do?
Yeah, so I am a current resident at the University of South Florida. The residency program that I'm in is called Physical Medicine and Rehab. It's kind of a not well-known residency program, but it's an international specialty. You have to be an MD or a DO to go into it. It's also known as PM&R or physiatry. It's known as a bunch of different things, which is probably one of the reasons why nobody knows what the hell it is. Um, so I guess a little bit of background about me. I grew up in a little panhandle town in Pensacola, Florida, right outside called Gulf Breeze. I was born and raised there. I grew up around the Andrews Institute. So for those who don't know that are listening, Andrews Institute was like the world-renowned place for a lot of athletes to go to get surgery, to have rehab, to train for the NFL draft, and to an extent, it still is. But it was like the coolest place ever to grow up around because like as a little kid, I'd be walking home from school and you'd like look over and you'd see, Shaquille O'Neal or like a LeBron James or a Tim Tebow in this tiny little hometown that there's not that many people there. And I think that they set it up to kind of, get a little place of solitude. Not a lot of people are bugging them. But from a young age, I kind of got obsessed with human performance and just trying to maximize everything, whether it be personally or with other people. I remember when I was a kid, I had one um, Santa list that I sent out, and I remember my mom saved it, and it said that on my Santa list, I was like 7 years old, and I asked for like the world's best toothbrush. So like, I was just like that weird kid that at every turn I was trying to figure out the absolute maximum best way to do things, and so yeah, I kind of grew up with that. I knew that I was going to go into medicine, didn't necessarily know what I was going to do. Um, I went to Ole Miss for my undergrad. Had family that went there. I kind of grew up around it. It was a smaller school, it was more intimate. I loved the culture there. Just a really cool place to go. Um, During those 4 years, I was like constantly sick. I on the outside looked great. Like it was probably the most fit I've ever been on the outside in the mirror. But I had strep throat like 4 to 6 times a year, every single year that I was in college. And by the time
Wow.
that I graduated, yeah, and it was kind of this cycle where I'd get sick, I'd go in to like an urgent care or something, they'd give me a shot, they'd give me a steroid, they'd give me an antibiotic, and then they'd send me on my way. And I'd come back like 4 weeks later. And it happened, it was just this recurring cycle where it got to the point where like if I would go out with some friends, like I knew I was gonna wake up tomorrow, be sick, have to go in, test positive for strep. Um, and it was weird because I had met people that, have never had strep throat in their life. My fiance is one of them, like never tested positive for strep. And this was happening on a recurring basis every single month. By the time I graduated college, I went and printed out my records to bring to an ENT because I just wanted to prove that I wasn't crazy. And I think I had like 21 or 22 diagnosis, like actually tested positive for diagnosis of strep while in college in those 4 years. And so from that age, I was like, all right, what's going on? Like I look good on the outside, like I should be feeling good. Nobody ever really tested me for like, in-depth labs of why is this going on? What's your inflammation looking like? What's your diet like? Um, what's your day-to-day look like? Are you sleeping well? It was kind of just, oh no, you're in college, like here's another antibiotic and like go on your way. And you don't know what you don't know. So I just thought, okay, well, there's got to be other people like this that are out there that, maybe this is normal, whatever. Um, so I got my tonsils out like right in between college and going to med school. And that was, I thought was going to be the end of it, right? Like you get your tonsils out, you're never going to have strep again. And then I tested positive for strep 6 weeks after that,
Oh
which I
no.
thought was not possible. And it was the worst strep I've ever had, like the biggest sore throat. Like it was just horrible. Um, I ended up having, a bunch of sinus stuff going on too. So they convinced me to get sinus surgery. So I kind of went through the ringer that a lot of people go through whenever they can't figure out what's going on. They think that, if you go to a doctor, you get a pill, you get a surgery, it'll all be over. And I fell into that trap. And so um, I realized after all that okay, there's maybe a little bit there's something else out there that's going to get to the root cause of the problem. So all of that to say, I go into medical school. I thought that I was going to be a surgeon, and I was attracted to surgery at first because it's one of the few things that, a patient comes to you, you fix the problem, and they leave better, right? Like you can see the change. And unfortunately, that's just not the way that a lot of primary care works. When I was working with, internal medicine, family medicine, things like that, a lot of doctors are so pressed for time and they're having to crank out so many patients within a day that they don't really get to sit down and put in the work to, explain to a patient and teach to a patient about diet. And I figured out that, you're seeing a lot of the patients over and over with the same problems and you're not really fixing anything. You're just putting band-aids over certain symptoms. So after a couple of years, I approached my mentor at the time, who was a plastic surgeon, genius guy, trained at Harvard. I was like, look, man, like I don't think I love surgery. I don't like being in the OR that much. I like interacting with patients a little more. I like having my hand in different buckets. And he's like, okay, well, you should go into PM&R. And I had no idea what that was, just like 99% of people. I got in contact with some people, kind of went down that rabbit hole of, shadowing different people. It was a little bit more of a root cause focus. You're focusing a lot on physical well-being, getting the patient back to where they were before. A lot of these people are, post-stroke, post-spinal cord injury, post-brain injury, post, sports injury, amputation, and their lives have been pretty much wrecked from what their baseline was. And it's a cool thing because, they're stabilized in the hospital and then they usually go to an inpatient rehab center, which is where a PM&R doctor would take over from the medical side of things. And at that point, they've already kind of accepted, like, my life has changed, and you're getting them at their most vulnerable, and then able to take them from, step one to step two, and they're relearning, how to walk, how to do activities, daily living. And so that was something that for me was very rewarding. You get to actually see a change pretty acutely in certain patients. And, kind of mixed into this process, I was just reading books on my own time and doing my own research and things like that. And I figured out the whole, I guess, umbrella category of what's called functional medicine, which has grown in a lot of traction recently. And I'm glad that it has, because functional medicine, in a sense, is the practice of focusing, on a root cause basis, like looking at a patient as a whole instead of certain parts of a patient, and trying to figure out how things like their diet, their hormone, their lifestyle, their exercise all comes into play, and doing a deep dive into, lab analysis, body composition, things like that, and trying to figure out, how do we best optimize each patient on an individual level, and how do we give patients the time and the um, the mental, um, I guess, focusing on each patient as an individual basis, not having to get through and churn through 40 patients a day, getting to spend a little bit more time, like an hour per patient or whatever. And so that just fascinated me because, I was thinking back as a kid, I just loved doing those things. I love thinking about each individual patient as a puzzle and trying to put together all of the pieces instead of having to just rush through each patient, prescribe an antihypertensive, and then be on your way. So I found my way into that. In residency, I'm also doing a fellowship on the side, more for the functional medicine stuff, through this company called A4M. It's the American Academy of Anti-Aging Medicine. Um, and hopefully, when I get out of residency, I want to try to put all of that together in one, focus on a patient from the bottom up, look at everything from a root cause perspective, do in-depth analysis, try to figure out what's going on. A lot of these patients are just like me. They've been through the ringer. They've done everything that traditional medicine has tried to push them to do, and nothing's really gotten better. So I like to think of it as, if you live in an apartment complex like I do, and your roof starts leaking in your bathroom, right? You call a plumber. The first plumber comes in, he looks at the roof, he puts a patch on the roof, and then he leaves. Well, a couple of days later, roof keeps leaking, right? You put a bucket under the leak, bucket ends up filling up. You got to put a bigger bucket under the leak, call the plumber back. He puts another patch on the other spot that it's leaking. And it's just kind of this cycle of, nothing's really getting better for a long term, when you really could have, you know, called that one plumber that may cost a little bit more on the front end, but he's going to actually go upstairs to your neighbor, go in their bathroom and turn the water off and fix it from where it's happening in the first place. So that's how I like to think of functional medicine. It's not prescribing a drug for your insulin, a drug for your hypertension, a drug for your depression, for your anxiety, all of which have side effects and can affect the next thing. So it's really looking at a patient with a full history, a full lab analysis, and then starting with things like diet, lifestyle, supplementation before getting into the medication instead of just prescribing that Band-Aid off the bat. So I know that was a mouthful, but
No, it's okay.
that's kind of how I'm thinking at this point.
Yeah, I love that analogy so much. And with all that background, did what you've learned so far help you? Are you strep free now?
I'm strep free. Yeah. I haven't
Yeah.
had strep in a long time. Yeah,
I've
it's
been
been
worried
a
about you.
yeah, and it's weird too because I was in college, I was working out all the time. Like I was at like 8 or 9% body fat, something I'll probably never see again. Knock on wood, hopefully I do. But uh in the mirror, I looked great. And in my mind, I'm like, I'm doing great. I'm just getting sick. So therefore it can't be my fault because I look good, therefore I'm doing all the things. And it's funny now that I look back, you can see the inflammation in old pictures. Like you can see, my lymph nodes are swollen, my face is swollen. Like I just look chronically inflamed. And at the time, I just had no idea. And so now, yes, I feel much better. I'm eating better. There's just incremental changes that it wasn't an overnight thing of, oh, okay, I'm going to decide to do this, and now I don't have strep or I don't get sick anymore. I still get sick every now and then, but it's those tiny little steps of going in the right direction that's made a huge difference over time. And that's just what I want to share with other people is that, you might be suffering and like so many people are in chronic pain or have chronic illnesses but if you do the right things, there is a possibility that it at least gets incrementally better over time.
Good, so there's hope. That's really remarkable that you're saying you're able in your specialty to spend a long time with the patient because I think everyone's been through this kind of hamster wheel situation in the medical field. You go in, you check in with the office assistants or the nurses or whoever is on site that's doing your charts and checking your blood pressure. And when and if you actually see your real doctor, right, you have
Right.
10 minutes with them at best. And a lot of times, and maybe this is just my experience, but even when I'm with the doctor, they don't seem present, right? Like you can
Right.
see the wheels turning and that there's a thousand things going on. And just as far as basic labs and the annual physical, what are the things that you feel like are missing that are so obvious to you should be part of a person's regular checkup?
Yeah. I think a lot of us, especially in the functional medicine space, kind of a little bit distant from like, I guess what you would call traditional medicine, we love to jump into in-depth lab testing. And I think that's totally important, and we'll get to that too. But it does downplay the fact that an in-depth history from the patient is probably going to do a lot more than pretty much any other thing that you can think of.
Mm.
Um, we like to get caught up in the shiny bells and whistles of things like supplements and things like that. But when you boil it down, 99% of problems are at least in part caused by diet and exercise. And if you can change those lifestyle things at first through a history and physical, trying to figure out what your patient's going through, how their day looks like, what they're eating, that's going to make the biggest change on the planet. And what a lot of people don't realize, like the word doctor actually comes from a Latin word that means teacher or instructor. So you can ask everybody that's been to med school, and if you ask them where doctor came from, most people are going to say, "Oh, it's healer, it's treater, it's somebody who diagnoses things." And we've gotten away from that in traditional medicine because doctors are so pressed for time. I mean, I think the average now for a primary care visit is like 8 to 12 minutes or 8 to 15 minutes per patient per average primary care, visit. And that's just doing patients a lot of disservice because doctors are coming in, they don't have a full picture. Insurance doesn't really allow them to get a full in-depth lab analysis, and we can talk why. They can't get a history. They don't really know what their patient's going through, and they only have a certain amount of time to figure out a problem or at least a symptom and put a patch on it so that at least the numbers make it look like they're doing their job. And I want to say this too, it's not physicians' fault. I think 99.9% of physicians go into this specialty with this glorified view of what it should be. And then once you actually get into it, the vast majority of people I work with are just so beaten down by the system that they just end up accepting it and they just go and they're working a 9 to 5, just like, you would going and crunching numbers in a cubicle in a desk somewhere. And that's the kind of job it turns into just because of the amount of paperwork and, prior authorizations for insurance. And there's so many steps now that are just added over and over again. And it's one of those things that's like, you don't know you're crossing a line when you're taking tiny little steps across that line. It's a lot less obvious than taking the big leap over. So we found ourselves in a place that you look around and finally, if you take a step back, you're like, this is not medicine. It used to be called the art of medicine, and now the art part is just completely taken off because it's all protocols and documentation, and you really only get to spend about 10% of the time with the patient. So all that to say, I think if we were doing it right, and you're a patient and you're going to see a doctor, and I encourage the people that are listening to try to find some sort of functional medicine doctor in their area. Although it can be more expensive up front, I hope it, saves money on the back end. And some are more expensive than others, so do your research. But it should look like coming in, doing a full intake, so telling them, what you're eating, how much you're sleeping, what you're doing to go to sleep, how much light exposure you have going to sleep, what your bedroom looks like. I mean, you can get so in depth into it and find little things that just the minor amount of tweaking, like, oh, like turn off your fan light, after like 4 p.m. and just use lamps. Like that,
Mhm.
that in itself makes a huge difference in melatonin production. So if you start picking up on these little things, doctors should realize like, oh, okay, we can tweak these few things, maybe add a supplement or two, and we can avoid medication. We can avoid, if you're not sleeping well, your blood pressure goes up, your insulin sensitivity goes down. I mean, there's a lot of things that end up coming of that. So, full intake, a full lab analysis. So, things like the things that I can think of that aren't typically in your typical yearly physical are a fasting insulin. That's number one. That's one of the earliest signs of being able to pick up metabolic insufficiency, which that's the big buzzword of right now. And I think that's what leads to 99% of chronic diseases. So fasting insulin, most doctors already get a fasting glucose. You can use those together to kind of synergistically to create a better picture. Your typical cholesterol analysis is always good. It doesn't tell you a lot. So what we do is go a little bit more in depth. So we order things like an ApoB, which is actually way better than a regular LDL in trying to figure out your risk of heart attack later on. Um, LP little a, that's another thing. It's lipoprotein A. That shows us your genetic risk. And if it's strikingly high, that tells us, okay, you have a very high genetic risk, and we need to take more of a look at that person and be more proactive about everything. Um, a CRP is a measure of inflammation, just overall inflammation. We can take a look at that. Ferritin is kind of one of those that's with your iron lab. So a lot of people just think of ferritin and iron. Like if your ferritin's low, you have iron anemia. Nobody really thinks like, oh, if it's high, that doesn't really mean anything, right? You're stocked up on iron. It's actually an inflammatory marker. So if
Oh,
we take a look at that in that way, we can figure that out. Homocysteine's a big one. That's like my favorite. And it's pretty easy to correct. If your homocysteine comes back and it should be, around 5, hopefully just less than 8. If
what
it's
is
more than
that?
that, it's basically an inflammatory marker that is telling you how well your body is able to clear toxins. So if you look at what's called a methylation, you can look at a methylation graph and it shows like the big process of what's going on. But basically, if your homocysteine starts stacking up, that means your body is not able to methylate things and clear that homocysteine out. And it can be, inflammatory when it starts growing. I think you're turning homocysteine into methylmalonic acid, or homocysteine into, I'm forgetting the the actual thing that it does turn into. But anyways, if homocysteine stacks up, that just basically is telling you that your body's not doing its job of clearing everything correctly. And that's like an easy fix. You can take methylated B vitamins and just watch that value drop. And that's just telling you, if you're taking that methylfolate, especially, that is pairing with homocysteine to basically clear it out of the body. So that's a big one. That's one of my favorites. You can go into the omega 3s. Vitamin D is a huge one, magnesium as well. And the problem with, if you go to a Quest Diagnostics, which is where we take all of our labs, most of us, Quest or LabCorp, or, even at the office, the reference range that it gives you, it bases that off of the general population, which is typically unhealthy, and also off of, it wants to do the ranges of, too high obviously is dangerous, but also the low value of the reference range is more of they want to look at, if you're lower than that, then you're at risk, not necessarily what's that optimal range. So like a vitamin D, it'll tell you that a vitamin D of 32 is normal. When in fact we want to get it up to like 60 to 80. And like you typically see, it's involved in about a thousand processes in the body. And if you get it up to that range, then you're really optimally performing. And that's kind of the whole scheme of this is within functional medicine, we don't want to put people at the bare minimum. We want them to be performing and minimizing their risk optimally going forward.
Wow, so there's a lot missing that this should be basic education that we go through, if
Yeah.
not in high school, at least in college, so that people know what to look for. Because sitting here, as a person with no medical background at all, I don't know so many of those words you said, and I'm a person that actually goes out of her way to try to figure out things and to try to optimize for certain health. On my own, I've learned, oh, sleep quality can be completely wrecked just with the tiniest little light on if you don't even suspect it and you think it's not preventing you from going to sleep. But again, that's because I've like gone out of my way to learn these things myself. It's not like I've
Right.
ever heard anyone in a medical space share that with me or suggest that for me. And then circling back to the cholesterol conversation too, high cholesterol does run in my family.
Hmm.
And for, I think, the last maybe 3 to 5 years of physicals, they've
Hmm.
tried to push statins on me and they've been like,
Hmm.
hey, your cholesterol is incredibly high. I had a follow up with my um just general practitioner who was saying on our like Zoom call, he goes, hey, you should like try working out. You should try losing weight. And I'm like, sir, I'm at the gym 4 days a week. Like that can't add up. That doesn't feel like it's really for me. And so it would just be nice if people had more of a general
Yeah.
understanding of this stuff. So if someone goes out of their way to get these labs done, what do you think, what markers should they be testing for that they've probably never tested for?
I think everybody needs a one-time lipoprotein little a, LP little a, that basically shows your genetic predisposition to damaging cholesterol and therefore heart disease. That's a good one. And you only have to test that once. If it's super elevated, you have that genetic predisposition. You don't have to necessarily follow that lab. You can follow other labs, being the next one being A ApoB. ApoB is basically in that whole cholesterol LDL sphere. It's just shown to be a higher likelihood of if that's elevated, you have more risk, right? When you start to think about the cholesterol talk, another one being, when you go to your general practitioner, they're going to give you triglycerides, HDL, which they call good cholesterol, and then LDL, which they call bad cholesterol. And now we've kind of figured out like that's not really the whole story. To kind of to basically paint a picture about this, if you think of you just have a big, let's just say a 5 gallon bucket, right? If you I'm trying to figure out the best way to say this. So, without going into too
And it,
much physics of
yeah.
it, if you have 100 golf balls that have the same volume of one basketball, you're going to have a lot more surface area when you combine all those golf balls than you are on that one basketball, right? So if you're filling up this 5 gallon bucket with two basketballs, you can think about that as your arteries. So LDL, let's just think of LDL as a basketball versus a bunch of golf balls. If you have high LDL, but most of those are, let's just say, basketballs, it has much less surface area than it would if all of that LDL was made up of the small golf ball, the small LDL. And those large LDL molecules are much less likely to stick to the inside of your vascular wall than the small LDLs that are like the golf balls, right? So you can actually test this. You can do a full, a better lab analysis of your cholesterol profile and break it down into LDL large, LDL medium, LDL small, and get to figure out a little bit of, oh, okay, my cholesterol, my LDL is normal, but when I break it down, I actually have a higher percentage of LDL small that puts me into a little bit of a risk category. So you need to start paying attention to it. Like even if it's normal, and the flip side of that is that if your LDL is elevated and you start looking into the details of it and you have more LDL large, which are the basketballs and they're less damaging, less sticky to the arteries, then you're not as risk as you might have thought just based off of the traditional value. So those are big. Those are kind of like tips and tricks to use. A CRP, a high sensitivity CRP, that's a inflammatory marker. I always like that. And these are cheap tests. These aren't like $200, $300 tests. Um, get your iron labs, get your thyroid checked, ask for a full thyroid panel. Sometimes they only do a couple of them and it doesn't paint the whole picture. Uh, get a homocysteine. That's one that 50-50 people will get. Homocysteine is just awesome though. Like we talked about earlier, it just tells you kind of what inflammatory state you're in, and it's easy to bring those down with like methylated B vitamins. It's like the biggest one. I like omega-3. I don't know how much that costs. Maybe it could be a little bit more, but if you try to keep omega-3 in about the 8 to 12%, so basically if it's lower than that, supplement with omega-3s, high DHA and EPA, that's the breakdown of them. Try to find a high quality supplement. I don't like to go to like Publix or CVS or things like that. I kind of like to do a little bit of research and find that. Um, Vitamin D is a huge one. If it's less than 50, I highly recommend supplementing with it. Most people are good with 4,000 units of vitamin D paired with K2 a day, and that's great. Vitamin D3 and K2, that's all you need. You try to pair it with K2. The thought process around it is if you take vitamin D without K2, you're more likely to store calcium in your arteries, and K2 kind of shuttles that into the bone where it needs to be. Um, Another one is a magnesium. So a red blood cell magnesium basically measures the amount that's not, floating around in serum, but actually is within the red blood cells, and that's what we really want to look for. Try to get that around 5.2 to 6. And if you're obviously lower than that, supplement more with magnesium, or do it through diet. That's always a great way to do it. If you're eating a well-balanced diet, those labs are probably going to look a little bit better. But we're in an age that our soil's not as good, our food supply isn't as good now. We're mass producing things, and it's really hard to get those nutrients. So I think the vast majority of people, we're at the point where if you want to live optimally, you might want to think about supplementing some of those things that you're lacking.
What do you think most people aren't including in their supplements that they should be? Because I know I take like a multivitamin, I take magnesium, I take creatine, but again, I'm a little probably advanced. I put that in
Yeah.
air quotes for anyone listening as far as like
Yeah.
you figure out. But I have gotten reports before that my vitamin D levels are not where they should be.
Mhm.
Is that something that you can actually genuinely get from being outside, or like does that actually fix people's levels, or do they need to supplement?
You can, but if you think on a um, you think of way back when, like we were outside all the time. In fact, we lived outside. And so now we're in this age where, we're inside all day, we're behind a desk, I know you're a comedian, so you're working on your material, you're going out mainly probably mostly at night, you're sleeping in more through the day, so you don't get that sunlight 24/7. And I actually saw something the other day that like even half of surfers are deficient, at least optimally deficient in vitamin D.
Oh
So,
no, there goes
right.
my one hobby that I thought might be helping.
Right, right, which is a great hobby, right? Like you want to get outside and that helps so many other things. But yeah, I do think that for the vast majority of people, 4 to 5,000 units of vitamin D is fantastic. In terms of other supplements, I love magnesium. Take magnesium at night. For almost everyone, it's going to be beneficial. I like magnesium glycinate. I take 200 to 500 milligrams at night, every single night. I take magnesium malate in the morning too. Sometimes I don't even know what dose I take actually. Probably two to 400 milligrams. The different types of magnesium, a little interesting. Malate is, I like to take it in the morning. It's more for like chronic fatigue, pain, things like that, energy production. Glycinate just kind of gets your total level of magnesium up, and it's not a very expensive form of magnesium. It helps with sleep. Magnesium threonate is actually my overall favorite one, and I love to take it, but it's just expensive, and so I don't take it that much. But when I have consecutive nights of, man, I'm not getting good sleep, I'll take magnesium threonate, and it's the only one to cross the blood-brain barrier. So it's like fantastic for just being able to wind you down, kind of get rid of that internal voice in your head that starts acting up when your head hits the pillow. Yeah. In terms of other ones, multivitamin's great. It just covers all of your bases, at least minimally, so that you're not at an extreme risk for any sort of vitamin deficiency anywhere. I'm a huge fan. You can cherry pick any of the studies. Some people try to bring up studies of like, oh, like it's just expensive urine, like it doesn't really do anything. And when you go and look at those studies, a lot of them, if you look at the one, basically, if that patient was deficient in a certain vitamin in the first place, and two, what dose are they taking of the multivitamin? There's a lot of other factors. I found some recent studies too that just came out that show that taking a multivitamin actually decreases your mental aging by about 2 years by the end of life. So I'm a huge fan of multivitamins. They're cheap. You can find some cheap ones out there. I love omega threes. If you think of things that are going to just play the biggest role in the long term, omega threes are those that you might not take it and then feel something, right? Like you can take creatine, and within a certain amount of time, if you've never taken it before, you're like, wow, I've actually put on some muscle mass. I might have a little bit more energy. Omega threes, you don't really get that feeling, I don't think. Some people do, but the most don't. And so a lot of people just take it and they're like, I don't want to take it anymore. But you think of in terms of heart health and especially brain health. Your brain is vastly made of fatty acids, right? So like that's a huge makeup of your cognition, your brain. So if you think about omega threes, you're just feeding that process. So if you think about, cognitive aging and cognitive decline at the end of life, I really do think if you are constantly taking omega threes, that you're preventing that as much as possible. Um, Other supplements that I take, there's some fun ones. Like if you take like L-theanine, I love L-theanine. That's one that if you take, 100, 200 milligrams of that, you can either take it to sleep, it kind of calms you down, or you can take it in the morning with coffee. If you're one of those people that gets the jitters from coffee, uh, it's great. It just like it gets rid of the caffeine jitters like completely, and it actually works synergistically with caffeine to create a little bit more of a deep focus. Ashwagandha's one too. I don't take it every day for like my whole life, but I'll do, a month on, a month off, and it's great for just lowering that cortisol, which is the stress response. So that's why I tell people to just at least try to go get one in-depth lab analysis because then you know which bases to cover. Like if your cortisol is elevated, maybe do some ashwagandha. If your testosterone's low, you can focus on things like zinc, ashwagandha too. It lowers that cortisol. Um, Tongkat Ali is another good one that has some studies around it that raises testosterone. So uh, I, I don't like to just blindly tell people to take certain supplements, although
Mhm.
like vitamin D, magnesium is kind of a no-brainer. But I do like to have a little bit of data so that you're not just, shooting a shotgun. You're more so picking and choosing different things that you're gonna target and then see how you feel when you start doing that.
What's something that you've learned about longevity that you wish everybody knew?
Ooh, probably, I've always been somebody that worked out and did strength training mainly just for like aesthetics. Like when you're in college, you like want to look good at the beach, you know? And I didn't realize how important that is in the grand scheme of things. So like I would want everyone to know, well, first of all, like we just talked about, treat micronutrient deficiencies with simple supplementation. Just cover your bases so that you're not at risk. But about strength training, building muscle and just training 2 to 4 times a week is one of the most powerful longevity tools that we have. Like if you could put exercise into a pill and take it every day, it would be the most sought after patent of any pharmaceutical country or company on the planet. So, muscle mass protects us against diabetes, like spiking blood sugar. Your muscles are the first things to take in sugar whenever you consume a high carb meal. Heart disease, frailty later in life. You think about things that people die from. A huge one is hip fractures whenever you get older, especially in women. Like the mortality rate after a hip fracture and like within the first 6 months is something like 50% of people don't make it past that. It's something
Wow.
insane. And if you're strength training, you're not only building muscle, which is going to act as pretty much like a pad to protect those bones, but also you're weight loading those bones and they respond to that by building. So yeah, I mean strength training is like the biggest one. Cardio is as important. To me, I would put it slightly less important, although I know people are not going to like that. But just because it's great for cardiovascular health, it's great for brain health, everything else. It's like the most potent antidepressant on the planet. I mean, cardiovascular exercise and weight training outperform SSRIs in like every study. It's
Wow.
incredible. Yeah.
I mean, selfishly, I know that.
Yeah, exactly. Yeah.
I wanted to ask you because you work with regenerative medicine. Can
Yeah.
you just explain, like I'm a third grader, what that is and whether or not that's an effective tool to circumvent surgery?
Right. Yeah. So in a sense in this, I'm kind of a third grader too, because I'm learning pretty much alongside everybody else. When you think of regenerative therapies, I think typically what we think of are things like PRP, which is platelet-rich plasma, stem cells. Now there's this talk of these new ones called exosomes. Um, Peptides kind of play into that realm too. So just to kind of break all of it down, all of these things use the body's natural processes to help it heal itself. So they're not a full replacement for things like surgery yet, but they can definitely delay and even avoid the need for surgery in certain cases, especially for things like tendon tears, arthritis, cartilage damage. I think of it as instead of instead of seeing a pothole and putting all of the warning cones out next to it to try to get people to avoid it. So like I think of the warning cones like pain medications. Instead of doing that, regenerative therapies actually help and rebuild the road underneath it. So it's a really exciting time. When we think about stem cells are basically cells that have this unique ability to differentiate into cells that the body needs, like muscle, fat, tendon, etc. So the actual process of it still is not widely understood. And when people are talking about, doing IV stem cell therapy, that's something that's way over my head because I have no idea how a brainless cell is able to recognize something that's going on in the body, direct towards that particular disease process and fix something. That's something I have no idea. But it's becoming more available. But in my realm, we're doing more of the joint injection stuff. So it can help delay surgery. If you're bone on bone arthritis, not a lot of data behind that. You're probably going to need a knee replacement at some point, at later in life. That's just that. Hopefully we get there. If you have a complete tear of your Achilles, that tendon that tendon snaps back like all the way to the upper portion of your leg.
Oh.
Stem cells are not going to make that tendon, gradually come and meet back with the other side of it. So it has its limitations, but it's so exciting. And so things like exosomes, which is becoming a new one. That's basically if you think about a stem cell, which stem cell therapy is in the United States is typically a little invasive. You're either taking that from bone marrow on the back of your hip, or you're doing like a liposuction. You're spinning it in a centrifuge and you're taking out those individual stem cells to re-inject. So it's a process. Exosomes are interesting though because you don't have to do that whole process. You basically are able to like ship them in. There's not a huge risk of injecting it into somebody else, even though there's stem cells coming from somewhere else, because they're not cellular. My thought process behind it is that they're the messengers that stem cells send out to a certain body area or body process to do a certain activity. So basically, a stem cell is, let's just say for knee arthritis, a stem cell is the message that I'm sorry, an exosome is a message that a stem cell would release to tell the body, hey, we have something going on here. You need to send health and healing factors and growth factors to this area to help us, regenerate this damaged tissue. So that's a really interesting one. That's one that's been pretty new and growing. Peptides is huge too. We've all been starting to hear about this through, Andrew Huberman and Peter Attia and like the Joe Rogan, all the Joe Rogan listeners in the world have started to really be exposed to peptides because it's a really promising thing. It's a peptide is a small version of a protein, right? So if you think of a protein, it's a chain of amino acids, and a peptide is just a smaller chain of that. And if we think of some of the most well-known peptides, it's, insulin is like the most famous peptide of all time. It was one of the best discoveries on the planet. Ozempic is another peptide. There's other ones for growth hormone. There's ones like BPC 157 is a huge one for tissue injury, and like you can basically inject it. It comes from your stomach, and it helps out with both tissue injury and stomach repair for people that have like IBS and those kind of things. So um, much lower or much better safety profile with things like peptides than taking medication, taking NSAIDs, taking things long term. So it's really fun because you actually get to play into the body's natural processes to help pretty much dissolve or at least alleviate some certain symptoms.
It's very hopeful that these kinds of things are being worked out and that it is starting to become general knowledge or at least accessible information for people. Is there something that you feel like people are doing at the gym that they're like hurting themselves and you wish they would stop?
Yeah. Um, And you never want to discourage somebody from going to the gym. So that's number one. Like if you don't go to the gym regularly, like go. If you're not comfortable in a gym, you know, do some things at your home first until you get comfortable. Look up some videos. go and get a personal trainer, even if it's for one session, and just tell them like, look, I can't afford coming back here and seeing a personal trainer all the time, but I want you to walk me through at least the compound movements like squat, deadlift, bench press, overhead press, all of those things, and get the form down. And just ask them like, hey, I'm not comfortable in a gym. I haven't really spent much time here. Can you like walk me around and just kind of tell me how to get comfortable being here? That is huge. Like that is worth paying somebody $100 to go and just have them walk you around and show you the ropes so that you're more confident in going in there. Um, there's three big things that I would look for in people that are kind of messing it up on the front end. It's seeing these things, like seeing people on Instagram talk about, you need to lift heavy, you need to do compound movements, but you don't know the form. So if you go into it lifting heavy without good form, that's just a recipe for disaster, right? You're going to get injured. You're going to have all these long-term consequences of that, and then you're never going to want to go to the gym again. Um, Playing into that, if you ignore the mobility part, that's huge. If you can't move well, don't lift heavy and do a movement that you're not comfortable doing. Kind of plays into the same thing as form. And then I see a lot of people skipping, uh, you a lot of people are lifting for aesthetics, and that's fine. That usually carries over into functionality. Um, but if you skip things like posterior chain work, so like your glutes, your hamstrings, your back, or these are the muscles that protect your vital organs and keep your whole framework upright. So if you're just doing arms and shoulder and chest, and you're not hitting any of the functional muscles, then you're not really doing yourself much good. I mean, it's good from a sense of like blood sugar management and things like that, but in terms of aging, like when you get to 75, 80 years old, do you want to be able to lift up your grandchild? Do you want to be able to, raise your luggage up and put it above you in an airplane? Like we think that we're going to be able to do these things just by default whenever we retire, so we're just cranking away until we do. And it's sad because I see it firsthand. A lot of people get to that point and then they get super depressed because they realize like, oh, I can't do these things. Like these aren't um, these aren't just a right we're given. Like you don't have a right to be functional. You have to work at it. It's like investing in a retirement account. If the more work you put in on the front end, the more safety net you have on the back end.
Absolutely. I just saw a video of a woman in her 90s that kept up with her workouts, and she was able to do a 3-minute plank, which for anyone that doesn't understand how hard that is to be doing that at 90, like I sent it to my mom. I was like, you got to hit the gym. You got to go. Come on, look
That's
at this lady.
crazy. I can't do that. I definitely don't think I could do a 3-minute plank right now. I'm one of those people that has notoriously overlooked abs and core in general. So I'm working my way back to that. I cannot do a 3-minute plank. So that's great for her.
Yeah, absolutely. Especially for women too. And I mean, I don't want to get into it because it's like a whole thing, but as our estrogen production stops, our bones get more brittle. And it's
Right.
this thing like you're then fighting an uphill battle for the rest of your life. So if you don't get on it ASAP, it's just going to get harder and harder to, restoring muscle that didn't exist, I'm sure is so much harder than maintaining muscle that you already have.
Right. And you saying that just made me realize that when we were talking about my favorite supplements, I completely overlooked. You had mentioned creatine earlier.
Mhm.
Creatine is unbelievable, especially in all the things that you just mentioned. We used to think of it as this bro supplement that might hurt your kidneys, and that's just kind of like your grandparents thought about creatine, right? And now we've realized like, oh no, it really doesn't cause any damage to the kidneys as long as you have decently healthy, functional kidneys. There is almost zero evidence to suggest that there's a risk for kidney damage as long as you're decently, you're drinking enough water and things like that, but the benefits of it are unbelievable. So, obviously the muscle growth benefit of it, you're gaining lean muscle mass. This whole thought process around, oh, you're just putting on water weight. Everybody likes to think that that's just going to be like some little sliver of water over your abs and you're going to actually look fatter. That's not how that works. It actually puts a little bit of fluid into your muscle cells. So if anything, it makes you look leaner. You gain a lean muscle, or lean mass, so muscle mass. If anything, it makes you look more aesthetic. You have the benefits of greater muscle, greater output, more strength. You're able to build more strength over time. And then when you think of all the other stuff that's coming out, it's a great neuroprotectant. It's one of the best supplements for sleep deprivation. So, if you have enough creatine in your system, you are more efficiently creating ATP, which is the currency of energy for us. And now things are coming out about, bone health later on. Now now we're starting to figure out that you can actually take more than what we thought. Some people are taking up to 20 to 25 grams of creatine every day, which
Wow.
I wouldn't recommend for everybody, but
That's
I'm
a
taking
lot.
10 I take 10 grams and like I've seen the research on it and I'm perfectly fine with doing that. Obviously, consult your doctor and don't take my recommendations as law, but 5 to 10 grams seems to be very healthy and relatively low side effect profile for just about anybody. Sometimes people need to titrate into it just because of like it'll upset their stomach sometimes if you haven't taken it before. But start low, build your way up. Creatine is one of the best ones ever to use.
Oh, I want to come back to the regenerative medicine and what kinds of injuries do you think are treated best with that? Like if you have blank issue, maybe not arthritis, because you're saying with arthritis it's like a little too much work for stem cells to do, but what
Mhm.
kinds of injuries or what kinds of deteriorations do you see in people that you're like, hey, let's do this first instead of jumping
Mhm.
straight to pain medication or straight to surgery?
Yeah. So I can tell you the kind of the chain of commands that we go by, or at least in residency and most practices do. So usually the chain of commands is that, somebody comes in and they have the option to either get, let's just say they're having knee pain. It does help for arthritis to a certain extent, unless it's all the way bone on bone. But if you still have some cartilage, you still have some tissue to work with, right? It's supposed to encourage either building or at least stopping the degeneration process. So if we have somebody come in, the traditional thing to do 10, 15 years ago, even now, kind of in traditional medicine practices, is all right, do you want a corticosteroid injection? Which that does help. That brings inflammation down tremendously, very quickly, and people see results in terms of pain quickly. The problem with that is that it doesn't last very long. It lasts like 4 to 6 months, maybe, usually about 3 months. The pain comes back, and then actually steroids tend to degenerate tissue more.
Oh.
So you're actually just speeding up the aging process of that tissue for some short-term relief. So we figured out, okay, probably not the best way to go about this unless you're just automatically accepting the fact of this person's going to get a knee replacement at some point and they're just delaying the inevitable until they, um, get back from a vacation in 2 years that they're waiting for, things like that. Then there's hyaluronic acid. People know that from, you can use it actually cosmetically. It's great. It's pretty dormant. It's not a very bioactive compound. Basically acts as a jelly substance. So you can inject that into joints, like hips, knees, things like that. It acts as basically a layer of jello that will stay there for 4 to 6 months. Some people get relief with that. Then we start getting into the regenerative stuff. So we usually start with PRP. At the VA hospital that I work a lot at the VA, the US government actually pays for veterans to get PRP. They used to do stem cells. Stem cells was too expensive now. So they do PRP, which is what that is that you basically draw somebody's blood, you put it in a centrifuge and you spin it really fast. And then when you take that out, what it looks like is the blood on the bottom and then this kind of yellowish orange substance on the top. And depending at what rate you spin it, you can have a lot of white blood cells in there or a little, depending on what you're injecting. So things like tennis elbow, rotator cuff problems, knee arthritis, cartilage injuries, glenohumeral joints, so shoulder impingement, hip stuff. You can take that stuff off the top and inject it into those areas. And what it does, we used to think it has a stem cell effect, which has a very small amount. Don't think it's that's causing the relief. What it does is that it has growth factors and healing factors in it that tell the body, it basically tells the body, oh shit, there's something going on here. We need to send the whole crew and fix this inflammation. So it creates a very brief inflammatory response. And the body basically goes to that area like the knee and then heals it quickly. And so you kind of get a relief. There's a pain relief aspect of it. And then, once you get through that inflammatory spike, it usually comes down below what it was before they got the injection. So PRP is a great tool to use. It's really not that expensive. I say that it's probably $500 cash. So that doesn't, that's pretty expensive. I don't know if insurance covers it for some things. But in terms of the ease, it's easy to take, spin it, and then do it. The expensive part is all of the centrifuges and stuff like that. So that stinks. You take it one step further, and then there's stem cells. So stem cells, you're going to have a little bit of the benefit of PRP. You're going to have those growth factors, things like that, but you're also going to have that added benefit of the actual cells that are going to send messages of saying, like, this is exactly what's going on. So we're having, let's just say you put it in your knee and you have arthritis and you have that cartilage is going away. It's not bone on bone yet, but those stem cells, in theory, recognize that and send messages to the body saying, like, okay, we need to either stop this process or actually rebuild. You can see in some studies. So stem cells are great. They're expensive though. I mean, it's probably like $1,000 to $2,000 to get a stem cell injection. And it's invasive. Like I said, you basically have to do a little bit of like liposuction or take it from the bone. Exosomes are coming out. That's just a direct injection. Those are like $2,000 to $3,000 now. So it gets more expensive. And what I'm hoping is because, and then same thing with peptides. This is one of those things that it proved to be very beneficial for people, and then the FDA takes it off the market. And you're like, why do they do that? It's not a safety thing. Maybe it's okay, maybe it's they want to get more studies on it, which that's partially true. But then a huge pharmaceutical company patents it and comes out with the same peptide, and then the FDA releases it again. And you're like, okay, that's a little weird. And this has been happening over and over again, where you can see the cycle of, all right, there's some other things at play here. They're not necessarily saving us from the safety profile of it. They're just wanting to make a profit. Um, so what I'm hoping is that, we're kind of getting to this weird stage of a change of arms. And, you could say a lot about the RFK administration, and I get it. I totally get a lot of the pushback there. But I do think that the main push of that whole MAHA movement is we just want to get data and we want to get the things out to people that are going to cause the greatest benefit. Because if you think about it, if you give somebody a stem cell injection and it fixes their problem, they're not going to be taking years and years of pain medications or getting other,
Yep.
injections or going and getting a knee replacement. Like the money on the back end, if you take those things off the market, you make way more money on a sick person or somebody that has a chronic illness or chronic pathology than you would if you just had a quick fix. So I'm really hoping that if we get some good out of this, that's going to be what it is. We start prioritizing the things that make people better instead of make other people really, really wealthy.
Yeah, it's so easy. I mean, it could be a whole nother conversation, the rabbit hole of conspiracy of that they want us sick because it makes them more money. And I don't know if you've heard about this, but this like makes me excited, but I also fear that our system as it is today would not encourage additional research on this. But I recently learned that period blood is one of the richest sources of stem cells. And I
Wow.
think the scientist that I heard about it from, she's in the UK, so I don't even know if
Hmm.
they're doing any research on that. Is that something that's like past your radar at all?
Not necessarily that. Honestly, that doesn't surprise me. It sounds wacky when you hear it at first.
Mhm.
But then you look at other things, like for instance, placental stem cells are like a huge thing in other countries, and they're a little bit either discouraged. They might even be illegal here, which is why a lot of people go to other countries to get stem cells because there's more of an efficient process to do so. Like if you're taking fat from like your own belly, spinning it, you really don't get that high of a yield. Whereas other countries are able to do things like placental stem cells, or they're actually able to replicate the amount of stem cells they take from you in a petri dish and re-inject it with 10,000 times the concentration. We're not able to do that here for various reasons. You can go down the rabbit hole. But no, I haven't heard that. That's super interesting. And I'm definitely going to look into that. But I really do hope that happens. And I have more hope now than I did in the past that things like that will at least come to light, or at least we'll take a deeper look into it. Um, but we'll see. I mean, only time will tell. All you can do is hope for the best at this point, and I hope that you could feel that there is at least you can feel this undertone of people, especially in our generation and the generation below us, um, figuring out that okay, everything's actually not what it seemed, and we can maybe take some steps to take advantage of our own health instead of leaving it up to, people that are probably making a profit off of it. So. I do want to say too, though, we can talk about how corrupt the system is, and it is very corrupt. I mean, you think about from the FDA level, at least in the past, and I'm sure now, hopefully that starts to get sorted out. But being in the pockets of things like big pharma or big health insurance companies, and how that it's this cycle that all of the money, it's a huge money making industry, and somehow if you follow the money, it typically comes back on the taxpayer on the in the end on their paying for most of these things. So um, we can talk about that all we want, and I want to make it clear that, although I'm speaking out against the traditional healthcare system, it's not doctors that are the problem. And I feel like it's human nature to want to find one big bad wolf in the movie, right? There's no Bond movie with 30 villains. Like you got to find the one villain to have a good movie. And so while we can place blame for things like vaccines on autism, or like, doctors are really like, just greedy and making too much money, doctors are only making 6 to 8% of the money that circulates through the healthcare system. I saw this thing the other day that
Wow.
there is the JAMA put out an article in 2021, and I think there's, man, it was something crazy. It was like 10 or 30 uh, hospital administrators to every one physician. So if you think about the money that's going through, I really do. I feel bad for doctors because I work with them every day. I am one of them. I'm on kind of the front ground, and they're the most beaten down people on the planet. And they have to continually crank out patients in order to make a living. Like the vast majority of us are getting out of, including me right now. Like I'm in residency. I'm not paying back any of my loans right now because I can't. Like I'm trying to just cover interest and everything. But we're getting out with, $250,000 in debt. And now we're making less and less, and we're having to see more and more patients. And then the cycle just viciously continues. And so, while a lot of it is our fault, we need to wake up and try to do something and stand up for ourselves. You can see why people get caught in the cycle, and they just have to keep cranking away just to try to feed them and their family, to try to pay off loans, to try to live a life that, going into medical school, they thought they were going to live, and they're just not doing so. So I just wanted to get that out there, and I'm not demonizing doctors. I actually feel really bad for the system that most physicians are in, and I hope that we start to change that kind of one step at a time.
I hope so too. And I heard it put this way, which I was like, oh, that makes a lot of sense. That the countries that seem to prioritize health and preventative medicine are the same countries that pay for their citizens' healthcare. So it's
Mm,
in their best interest to keep people healthy so that they don't have to pay more on the back end treating all these diseases that were, in theory, mostly preventable. And so if we were to switch the system up and have it be the same way that it is in parts of Europe or
right,
wherever in the world, they teach people about nutrition. They keep
right.
nasty chemicals out of their food. They prioritize, they build cities around walking. Something as simple as walking that most
Mm,
people, like our society, is just not built for because the automotive industry lobbied our cities to not be built for walking.
mm,
That kind of thing, like because then we're the ones that pay on the back end for all the health stuff.
right,
If our government was just taking care of it, they would be more incentivized to actually keep us healthy so that they spent less at
right,
the end of our lives.
right. It's a hard thing to debate because it's one of those that the more you know about it, the more you can easily debate both sides. So like
Mm.
you can either say, yes, if the government paid for all of our healthcare, we wouldn't have to be paying for it on the back end. You can also make the argument too that, okay, a lot of this is because of government intervention, right? Like a lot of this is because there's this watered down kind of veil over the public eye of where the money's going, when it's really, people in Congress or the FDA kind of in the pockets of all these other businesses. 95% of the FDA in the past, I think 90 to 95, ended up, whenever they left the FDA, went on to big pharmaceutical or big health
Yeah.
insurance companies and
Yeah.
made 10 times as much. They're the ones that are passing these laws. And so you could also make the argument of, okay, actually, it might be a little bit of because of the regulation that we're having some of these problems. So like obviously something needs to change. Either way might be better than what we have now. But I do think that in theory we have a health insurance model that could work if the veil was lifted and we figured out what was really going on, where the money's going, why is only 6% going to physicians? Like for instance, the Affordable Care Act, there's like a little clause in there that basically made it illegal for physicians to own hospitals. And you could see how that could be an easy thing to put out there. Like, oh no, doctors don't need to own hospitals. Like, they don't need to charge whatever they want. But when you look at the data, back when physicians owned hospitals, they had the lowest incidence of infection, they had the lowest cost of healthcare, and they had the highest patient satisfaction. So now hospitals are only allowed to be involved, be owned by churches. That's weird.
What?
Right? Health insurance companies,
Oh no.
pharmaceutical companies, and then private equity. So, you know, you don't have physicians who go into it literally with the genuine like thought of like, I want to heal people. Those people aren't at the top, and that's the problem. Like, I think that's where the problem stems from is that if you're running a construction company, you don't want somebody running the construction company that has been in a chocolate factory his whole life and only knows about how to make chocolate, right? Like that doesn't make any sense. And so it's turned into this huge profit machine and and then the taxpayer ends up paying for it. So you could go either way with it. It's just this weird thing. And I just hope that we start to make changes somewhere even if there's a knee-jerk reaction and maybe it just doesn't work out. Like let's just try something because we've been in the same system for so long and this current model isn't working. It was like back 80 years ago, whenever we didn't have chronic disease, health insurance was just like paying for car insurance. Like it was only used whenever your car broke down. It wasn't used for every time, like you don't use car insurance every time you go and get an oil change, right?
Right.
So health insurance has become this coupon card because everybody has chronic disease. And now it's just driven up prices. So like if you want to go pay cash pay for something, it's way more. So it is this really intricate and complicated process. And I'm convinced that the more complicated they're able to make it, the more likely the general public's just going to be like, I'm not figuring this out. Like, whatever. Like, just take my money and like, we'll just deal with it. Because the highest, the number one reason for bankruptcy in our country right now is healthcare costs. And like, that is mind blowing, right?
It should
So
be.
It, yeah, it should be mind blowing and it's terrible, right? Like you have a right to your own health. You have a right to be healthy. And like we need to start we need to start educating people instead of treating symptoms. We need to start spending more time with our patients. The money needs to start being prioritized more towards doctors, not because to make them richer, but so that they can see less patients in a day and spend more time. We need to be encouraging people to be doctors because this current system is not, if you're in college right now and you actually know what's going on, the last thought I would have is, oh, I'm going to go be a doctor. No, because doctors are getting screwed and they're working in this brutal system. So, like, if the money starts to go the right places, then you're able to put priorities in certain places. And I just hope that it gets better in that way because I just don't like the thought of having all of these private equity people at the top trying to pump out a profit-driven machine.
Absolutely. Just a real quick way to end it on this. People are trying to hopefully improve their lives, get their health in check. What's the number one blind spot that you think people are not doing? Something easy they can add into their daily routine that
Mm,
will make an impact.
mm. I mean, there's not a number one. It's everything, and that's kind of the theme of this too. But if we're just gonna break it down, like bullet point it, eat well. Don't eat a super high carb diet. You're just gonna spike and crash your sugar. You're gonna feel like crap. Focus on protein. Like get as much protein as possible. One, it takes care of satiety, so you don't eat as much when you're eating high in protein. Um, it also keeps your mood a little bit more stable. You don't tend people tend not to gain as much weight when they're focusing on high protein diets because they're actually eating less calories. Uh, Focus on your fruits and vegetables. I used to be somebody that was like full carnivore and that made me feel great, but I've now realized the importance of getting, phytonutrients and things like that into your diet, especially, with eating high fiber, you're able to clear toxins easier. So high protein, high fruits and vegetables, and then think about your carbs. Like the carbs should be the very last thing. Prioritize sleep, cut off those lights that are above your head, after like 5 p.m. Focus on lamps, focus on very warm lighting, get the TV out of your bedroom. Um, Take magnesium before sleep, take vitamin D, go get your labs checked and figure out where you're deficient in. Like, yeah, it might cost a couple $100 to go do that. But just do it once, like figure out where you're deficient. Like, even if you don't go back every year, just start somewhere because we're spending money on all of these things all the time. But the body is really the only thing that you physically have when it's said and done. Like if you lose everything else, you're still stuck in your own body. And so we should be prioritizing that and normalizing, spend, spend part of your paycheck on keeping yourself healthy because I really do think that it comes back on the end, right? Like if you're spending more and you're taking care of yourself, you're therefore going to perform better. And I do think it works in that way. I hope it gets cheaper for everybody too. Function Health is a great one too. It's kind of expensive. It's like $400, but it's a full lab workup. You do it twice a year. And it gives you some actionable things to do and supplements to take and foods to eat. I have no ties to Function. I've just done it myself, and my fiance did it too, and we've found great value in it. There's probably other ones out there, so do your research. Um, Lift weights, get out in the sun, exercise. That's the best cure to depression. Um, Focus on your mental health. Try meditating. The body mind connection is a real thing, and it's proven now. So even if you don't think that you have a problem or think that you need it, do it proactively. You never know what's going to happen. Somebody's going to die. You're going to lose your job. Something will happen at some point. And if you're doing these things on the front end, it's going to help out a lot. So that's about it. Keep it simple.
I love it. Well, Dr. Clay Moss, tell people where they can find you.
Yeah, so Instagram is probably the best one. It's just Dr. Clay Moss is all one word, no periods or anything. Might start doing some podcast stuff in the future, but not right now. So I'll keep everybody updated on Instagram, and it's a learning experience. Like I said, I'm learning at the same time as everybody else. I think I have a unique stance just because I'm in residency. I'm kind of in the thick of it, and I like reaching out to people that are a lot smarter than me. And there's so many of those out there. So I'm learning. I hope everybody can learn along with me, and I just want to pass all of that along. So yeah, follow me on Instagram if you want to, and I appreciate it, Galina. It's been awesome. I really appreciate you having me on.
Yeah, thank you so much for doing the show, and thank you everybody for listening. Bye.
Bye, everybody.